All right, Chapter 18, Health Insurance and Healthcare. So again, in each chapter, we are answering a few questions, right? So the big questions for these particular chapters, there are 4 of them. So the first part, we are going to understand the important issues in this healthcare industry. There are quite a few issues that we will go over, 5 or 6 of them. And those issues are basically talking about why healthcare is so high of the cost in the United States. Contributing factors could be the demand side, the supply side, and just the nature of the industry. And then we are going to look at one big topic in microeconomics that I have not talked about just yet. So far, we assume the information available to everyone in the market, like symmetrically, meaning is available. Everyone knows about the information about the buyers, the sellers, and so on. But in reality, these informations are not readily available and basically asymmetric, meaning one side of the market might know about the information more than the other side of the market. So we will explore a little bit about asymmetric information and how this idea of asymmetric information affects the healthcare delivery. And number 3, is the market, right? So we're going to bring demand and supply of this healthcare industry and look at how demand and supply contribute to this high cost of medical services. And the last question is that once we put all of this together, look at all the issues, try to use demand and supply to understand the market, then we will look at several kind of design incentive system and see that how those incentives influence the quality of healthcare. Okay. All right. So I'm going to give you an overview one more time about this particular chapter. All right. So this is an overview of the whole chapter. So the roadmap of this chapter, right, which is an overview, we will be looking at, like I said, important issues in healthcare industry, and these important issues covered healthcare expenditures, where they come from, including the history of the healthcare in the United States. And then the more money we spend, how about the returns do we get out of this spending, right? We're going to revisit the concept of diminishing returns. And another issue is that how the insurance works. And we're going to put all of this together and see any of these things will affect the medical cost, right? Once we've done all of these components of the industries, the issues associated with these components, then we will look at asymmetric information, right? So the asymmetric information. So the healthcare debate centers around efficiency, to be more like inefficiently under-provided and unfair distributed, and very high cost, right? The cost containment is a problem. So part of these will be the longevity and the quality of life, right? It increases. And these are subject to the diminishing returns, like I said, and require choices with difficult trade-offs. So we will be looking at these trade-offs later in this chapter. Okay, so the widespread use of insurance alters the incentives the consumers and producers face when making healthcare decisions. So consumers pay premiums, right, upfront and have relatively small deductibles and co-payments. And you're going to learn later what those mean. Some of you guys might already know what those terms mean, but some might not be familiar with, okay? So these deductibles and co-payments, right, the consumers pay premium upfront and pay very small deductibles and co-payments when they seek medical care. So producers then, which are the doctors and provider, receive the bulk of their revenue from intermediaries, such as insurance companies. And the result is a system in which consumers demand more, too much, maybe sometimes medical care because they are insured. And many providers have an incentive to order additional tests or procedures that may not be absolutely necessary. right? So, and then from all of these issues, we look at asymmetric information. In particular, we will be learning about the principal agent problem, adverse selection, and moral hazard. Okay, adverse selection and moral hazard. So these are kind of behavior that people that interact with one another could change their behavior because of the different incentive. So this asymmetric information affects incentives in healthcare delivery. So insurance companies try to structure their plans that they offer, right, to encourage patients, which is consumer, to seek care only when it's needed, and also to seek preventive care. That's important. Preventive is cheaper than, emergency. So the companies then can achieve these goals by making many preventive care visits free and establishing deductibles and co-payments that are high enough to discourage unnecessary trips to the doctor or, unnecessary demand for additional procedure. But this high medical cost, we're going to use demand and supply to analyze this. So this demand for medical care is inelastic. So this inelastic demand, along with these third-party payments mean paid by the insurance company or the government, together helped explain why medical expenses have risen so rapidly, right? Part of this on the supply side as well, which is a licensing requirements that limit the supply of key healthcare providers, right? Licensing requirements provide a supply side explanation for these very high expenditures. Takes time, right, to produce any medical provider. In addition, hospital, they charge the hospital charges are rarely subject to competitive pressures, right? So in many small communities, there's only one local hospital, one clinic, or one specialist nearby. So providers therefore have what we already know from previous chapters, the market power, which they can use in setting prices. And many of the consumers don't know the price because we are not paying that directly, right? So the third-party payment. So all of this together is kind of contributing to the high cost in medical field in the United States. So, and the quality of healthcare then, depending on the different incentives, right? So now we will be at the very end, we're going to try kind of analyze several incentive system. Single payers versus private health insurance, right, or private health care. So when the government is the single buyer or the single payer, or monopsony, we never really talked about it. We know monopoly, which is a single seller. So monopsony, similar, but on the buyer side, when you have a big single buyer, that's called monopsony. So the government could be a monopsonist, right, of most medical care. It uses its leverage position to set compensation levels for providers that below the competitive market wage rate. So the single payer systems then instead of ration these medical services through the price rationing mechanism, they will do that through increased wait times. Whereas the private healthcare system ration medical care through the price rationing mechanism. So these are the things that we'll be looking at. So the demand for, on top of that, the demand for many replacement organs way exceeds the supply that made available each year, right? So the illegalization of selling human organ results in thousands of deaths annually. So many of which would be preventable if people were allowed to sell organs in legal markets. Sounds really gross, right? But what we'll see, we will try to explore that area of human organ, right? There's a human organ shortage. So the opt-out system in most European countries may be better than the current opt-in system, which significantly reduces the possible supply. So we will go through all of this in chapter 8. Okay, this is an overview, and we're going to start with the issues, and then we go to the asymmetry information, and then bring demand and supply, and then look at the single payer and human organ kind of market. All right, see you in the next lecture.